Hello everyone, welcome to another episode of Ask Dr. Bob, and I'm going to tell you right now, the group of questions we have now, wonderful questions. Here we go. Dr. Bob, fruit, someone is asking about fruit and fatty livers. This is what we've learned. Fruit, fructose is the sugar found in fruit, compromises liver function. We're seeing an epidemic of young ladies between 15 and 25 years old with enlarged livers that we're seeing on our x-ray. I'm telling basically everybody that comes into my life right now, if you want to get rid of pain and inflammation, get rid of the fruit. No smoothies, don't eat the fruit, half an apple every day. I'd like you to read a book called Adrenal Fatigue by James Wilson. You'll learn a lot from him. I've read that book 5 times. Fruit causes pain and compromised liver function. Dr. Bob, what about Graves' disease, which happens to be hyperthyroid? They really wanted to know what is going on because they had radioiodine and it compromised their thyroid. This is what I'm going to suggest. You really want to have a TSH, a T3, and a T4, and a TPO. We address and create protocols based on those findings. We use a product line from a company called Biotics Research Corporation, and we've had great success helping manage thyroid challenges nutritionally. You must get off of gluten and sugar, because gluten and sugar will compromise thyroid function. Now this is a very interesting question. Dr. Bob, I have a 7-year-old who has a condition called Molluscum Contagious. I did a little bit of research on it because I want you to know it's not like the most common condition we see in our practice. And it is a skin challenge, and it basically said it is caused by a virus. I want to talk to you about this. We have learned from our experience that viruses love to hang out in bodies where there's not enough calcium. Kids that are growing will burn through more calcium. That's why they get high fevers. We also use a product called Agricept L. I personally take 10 drops every day. I've been using it since 1996. Go to our website. It's a citric seed extract. For this child, you want to make sure that there's a lot of calcium. No sugar, no milk. Dr. Bob, here's another skin condition. It's initialed HS. So I Googled HS. Hidradenitis Suppurativa. It's a skin problem, and it was just talking about all these possibilities. When I read more and more about it, it talked about eliminating foods like sugar and fruit, wheat, dairy, and eggs. What I would encourage you to, anytime I see a skin condition that's caused by food, I go to the gut. We would encourage you to have a blood test with your eosinophil count. It's called a CBC, and a complete chem profile, and look at your CO2. Very important, by the way, carbon dioxide. If your carbon dioxide levels are low, we need to help improve gut function. So a lot of times when people have food sensitivities causing their skin, it's not the skin, it's the gut. L-glutamine. L-glutamine would go a long way. And a probiotic. We use Biodophilus 7. There was somebody who had a question about beet juicing from Live Strong. I want you to know I don't promote juicing. I have a lot of people that love the juice. Not that I have anything against juicing. If you're going to juice, not more than 8 ounces. I'd rather have you eat the beets. It came down to should or you shouldn't juice beets. Wash your beets, bake your beets, eat your beets baked. You could grate them raw on your salad. Okay, Dr. Bob, I enjoy all of your comments and study all the resources that you share. And they had a lot of questions about products. And I'm not here to say specifically what product you should or you shouldn't be using. We've had great success with Biotics Research Corporation, Gaia Herbs, Omega Nutrition. Yes, Swanson has a lot of wonderful products also. So I'm not going to tell you exactly what product you should or you shouldn't be using. I know we've had great results with those particular companies. Dr. Bob, I started having low back pain that went into my legs. What should I do? Come and visit us, because we have very advanced technology and we can do a video x-ray of your spine to find out exactly what's going on in your body. Dr. Bob, I continue to have breakouts on my skin and on my body, and how do I go about with living without medication? Back off on what you're eating. I would sit down and focus on green vegetables and protein. Stay away from grains, stay away from dairy, stay away from peanut butter. Those compromise function. Focus on green vegetables, non-starchy vegetables. What can I do for a person who has skin parasites? Well, first, make sure that that person's eating a lot of sulfur-based foods. Eggs, onion, garlic. Parasites do not like sulfur. Avoid sushi, pork, wild game. Is there a cat in the premises? And if you've been to a third world country, sulfur is key. Dr. Bob, I have a condition called achalasia for many years. That's where the lower part of the esophagus is tight. What I have learned from my experience, globus hystericus is a condition where a nervous throat occurs because a person doesn't have enough potassium. So I would encourage you, potassium. Green peas have potassium. Avocados have potassium. Multiple mineral would be wonderful. My question, Dr. Bob, this is the last question. How can I avoid colon polyps? You want to eat a pure green diet. You want to avoid all toxic food. I know it's not always easy, but I eat fiber every day. You should have 2 to 3 bowel movements every day. A lot of times we'll see parasites in individuals who may have a yeast problem, or we see polyps in people who have parasites and they have a yeast problem. A lot of great questions. I'm sure you're going to want to watch this again. Thank you. I'm Dr. Bob DeMaria.